Okay, so today we will be starting from the over-the-counter cold and flu and plus anti-inflammatory product. Okay. So still, the questioning skill are very important. I'll focus on the questioning skill. Okay, so maybe when we discuss a case later on, I want everyone to maybe ask a question. So you can start from like, okay, how long and the problem before, something like that. Just follow this slide. Okay, so the most popular drug on the OTC market is acetaminophen, which is in Australia or for the UK country, we call it paracetamol. They are the same, which is Panadol. Yeah. So we all know the maximum dose for Panadol is 4 grams per day. And when you double that 4 grams is the toxic dose, which is 8 grams per day. So when anyone like patient they purchase the Panadol or the products got Panadol, we always have to explain maximum 4 grams. So which is like 8 tablet because normally the dosage for Panadol is 500 milligrams. So we always have to advise 8 tablet in total. Yeah. And we have to also ask, are they taking any other medication? Yeah, especially when patient on warfarin. Yeah. But normally Panadol are quite good with warfarin, but only when patients are taking more than 2 grams, which is like 4 tablet of Panadol, and that might affect the warfarin. So when they're using the warfarin, it doesn't mean that they can't have Panadol, but they need to be aware or be cautious, because a lot of medication can change the concentration in for the warfarin. Okay, so we just have to tell them as long as the INR is under monitor, it should be okay. And we also have to check because patient may be taking some other medication which contain acetaminophen. Yeah, so we have to find out first. And sometimes the alcohol or patient taking like NSAID, anti-inflammatory, if they are taking for a longer period of time, yeah, which is sometimes can be no good for the liver. And aspirin allergy, yeah. People nowadays they are not using aspirin a lot unless they only use the low dose aspirin. So people when they say they're allergic to aspirin, normally 25% they are allergic to paracetamol. Okay. So this is we call cross sensitivity. Okay, we also check if the patient having the kidney disease or liver disease. Yeah, because we know Panadol they break down through liver. So if they have very severe liver function dysfunction or something, they has to be careful. Or the patient on lower sodium diet. So why lower sodium diet? Because some soluble Panadol, when you put it into the water, it will dissolve, right? Most of the product soluble tablet they have a higher amount of sodium, So when people they are on a lower sodium diet, you have to take those sodium into account. Or patient have pain, they've been taking Panadol for a long time, but it's still not helping them. That means they have to go back to see the doctor. Okay. And also sometimes the age or the weight, is it for children? Yeah, because if that is for children, we have to make sure the dosage is okay according to their age or the weight. Yeah. And anti-inflammatory as a um like Panadol is not is for the pain. We call analgesic. Analgesic is for the pain, but Panadol can doesn't have the effect for in anti-inflammatory. Okay, so most of the anti-inflammatory, um, I wouldn't say Panadol is an anti-inflammatory because it can help to reduce the pain uh, or fever, but it doesn't have the anti effect for the inflammation. Yeah. Okay. The next one is analgesic. Analgesic, which is NSAID, like ibuprofen, diclofenac, naproxen, mefenamic acid. They all we call it in Taiwan maybe call it NSAID, but that's how you read this word NSAID. NSAID. Okay. Make sure when people taking NSAID or those anti-inflammatory, make sure you tell them it has to be after food, weeks or after food. But Panadol, it doesn't matter. It doesn't matter before or after. Okay. Aspirin is pretty old medication or many old drug. So not many, there's not use, we hardly use aspirin as an anti-inflammatory now in Australian community pharmacy. Yeah. Uh, but we use lower dose aspirin. But lower dose aspirin is 100 milligram. For as an anti-inflammatory, aspirin has to be like more than 300 milligram. Okay. And especially for children under 12 years old, is not recommended because it can cause Ray's syndrome. Yeah, Ray's syndrome can be very no very bad. Especially after after kid they have viral infection or any flu or chicken pox, when they taking aspirin, that's the problem that can happen, called Ray's syndrome. But it's not a common practice now. So anyone coming in the pharmacy say, can I have aspirin? Yeah, if that is higher dose, try not to sell. Yeah, just maybe go for the other anti-inflammatory like Nurofen or Voltaren tablet. Yeah. Okay. Our first case scenario. Okay, first case. So this is the case. I want everyone to ask the question. Okay, everyone ask one question. So a young lady around 25 years old came in to the pharmacy and complaining about period pain. So she asked pharmacists can recommend some tablet for the pain. And she had similar problem before, and she saw the doctor, and doctor put her on Lebanon tablet, which is a contraceptive, 是一种避孕药哦。So what question would you ask? Okay, so everyone ask a question. Okay, ready? 我们可以请这个思云先问第一个问题吗？
嗯嗯，
还记得那张？Remember that slide for the I um
诶，
I emphasize
他
yeah
这个疼痛，他痛多久了？
yeah okay so it's how long the patient have the pain yeah
嗯
okay according to this lady she have the pain for a long time yeah okay second question 也我们请这个Sabia what question would you ask
Yes, Prof.
yeah what would you ask the
Uh,
second question yeah the first one how long the second one yeah yeah if you are the pharmacist just
uh,
just pretend just you are that pharmacist yeah I'm coming to the pharmacy hi can I have some tablet for the pain, for my period pain what question would you ask
uh, yes, Prof. Sorry for I think in India there is no medication for period pain. Like we can sometimes a doctor can prescribe ibuprofen for the period pain,
okay
but it is very risky to take tablets for stop the pain
okay
in the periods.
okay remember my in my the previous lecture I want you to ask all the question before you start
Okay,
recounting
Prof.
yeah just ask question okay so your question is yeah give me your question what would you
Okay.
ask hmm?
Yes. I will ask like have you any previous history of allergy?
Allergy no no allergy
Yes.
OK
Yeah.
那我们请那个玉芬你会问什么问题耶
我会问，那请问就是他是哪里的疼痛？就他只是说他疼痛，主要是头部的疼痛还是？
它是那个 period pain 就是经痛它
哦哦哦，我
对
有刚看到了。
对对
那我可能会问他在经痛前或者经痛这段时间，除了经痛以外，还有没有什么样其他的就是症状？
OK so her question sorry her question is like before the period any other symptom or any other pain yeah 没有 OK let's review the first slide then
Age of the patient. We can also
pardon Sabia can you say that again
sorry, Prof. We, yeah, we can also ask a question like age and age of the patient.
the age of the patient okay it's already it's 25 years old I'm 25 years old okay okay let's look at the slide again okay okay so this lady 25 years old period pain and asked if she can have some tablet for pain have similar problem before and doctor put her on Levolin okay and let's look at the first slide yeah here how long and have the problem before yes what's the symptom yeah just pain for the uh so what other question you haven't asked 好我们再请思云你还会再问什么问题
之前有没有吃过就是什么样的止痛药呢？
他都试我都试过了，我试过很多止痛药，然后后来我去看医生，医生开给我那个 Levolin，就是那个有避孕药，类似避孕药，或者是应该说是调经药。
嗯
So you know the contraceptive sometimes can like lower dose contraceptive can help to regulate your woman's period. Any other question? You haven't covered the whole picture of the question. Yeah, can you ask more question before we start jump to the conclusion? Yeah, Sabir, you wanna try?
No, Professor.
No? Okay. Okay. Check this out. My first slide. Yeah. What question you haven't asked?
有没有怀孕吗？
Oh, yeah. 但是有时候 sometimes for the lady sometimes can be very like inappropriate to ask them are you pregnant, right? So the question can be that this way: is there any chance you might fall pregnant? Yeah. 就是说因为他有可能他跟你说 when you ask uh, are you pregnant? Sometimes they say no, I'm not pregnant, but they might have chance to fall pregnant. 虽然她可能现在没有怀孕，可是她有可能，她是不是可能这个月她可能有发生一些性行为啦，那可能会导致怀孕啊，对不对？有没有这个可能？这些都要问清楚。Yeah, any question you haven't asked from this slide? 我们请玉玲。
我吗？
哎，对，试试看还有什么问题，在这张 slide 里面你还没有问到的。哦，玉芬，不好意思，说错了，玉芬。刚刚你们已经问了很多的问题啊，也还有一个没有问到。
还有什么？
看一下这个第五个是什么？The fifth one。
medical condition。
对 medical condition 就是你有没有什么一些慢性一些什么疾病呢？像说 diabetes、high blood pressure，或者对，就是这个都要问，这是基本款，这是基本的问题。所以不管你任何病人来，这些问题你都一定要先问完，你再开始决定你要给他什么药。好 ，OK。So the last question you miss here is for the medical condition. So we have to ask, have you have any like diabetes? Have you have any medical condition? Diabetes, high blood pressure? Yeah. So we have to ask all the questions before jump into conclusion. Okay. So for this case, you can refer to this reference. I already attach the file to in line, so you can read about it about how do you deal with period pain in community pharmacy. And also this copy is for the patient. We call self-care card. When the patient come in and to the shop, and we just give them some information to maybe they can have a read and know what is period pain or period problem. Okay, so we try that again. So try any medication before or any stomach or liver kidney problem. Yeah, because we got those anti-inflammatory can be no good for stomach or liver or kidney. So over 25 and never have the pain before. Yeah. So especially for this lady, she's 25. So never have the pain, if they never have the pain before and suddenly they have pain, so could be we call secondary dysmenorrhea. Yeah, this case we if that's the case, we normally have to refer to the doctor. Or you probably haven't asked if there any discharge, any bleeding or any temperature, fever. Okay. Because for people having endometriosis or fibroid or have pelvic inflammatory disease, we have to refer. And we also have to ask them, are they driving any like, are they dry? Do they drive? Yeah, because some medication can make people feel drowsy, so we have to be careful. Okay, and for period pain, normally the pain is involved the prostaglandin mechanism, that this activity. So to normally for period pain, anti-inflammatory like NSAID is better than Panadol. And also NSAID can reduce the blood loss about 20 to 40%. And reduce the pain 50 to 70%. And yeah, normally Panadol is no good for period pain. And also we can recommend something for like antispasmodic, yeah, 就是例如说它可以帮 Buscopan 它是可以帮助你的肌肉放松所以有时候除了给它 so besides the anti-inflammatory, sometimes the pharmacist can recommend you can have the Buscopan to help for the pain. But the problem for the Buscopan side effect can cause constipation and also blur vision. So you have to tell the patient, okay, this one can make you constipate. Okay. Also, we have to check, are they taking any other medication like anticoagulant or digoxin? Okay, those medication, the anti-inflammatory NSAID can increase the concentration in the blood. And also for anti-inflammatory, they can increase the blood pressure a little bit. So we have to tell them, this medication can make your blood pressure, increase your blood pressure a little bit, but it's okay as long as just be aware, be advised. Yeah, we'll be fine. Okay. And this case, because she already saw the doctor and also on contraceptive, but not helping for the pain. Because if the pain is from some the hormone things, normally doctor will prescribe the contraceptive. But in this case, after patient using contraceptive, still not helping, so that is a sign for you to refer to the patient to the doctor. But in this case, can you recommend any anti-inflammatory? In this case, I want to ask you，在这个case 里面，你可以推荐任何的止痛药吗？可不可以 ？Yeah, Sabia, would you recommend any painkiller?
Yes, Prof. Like ibuprofen, or mefenamic acid.
Yeah.
Yes. Yeah, diclofenac.
OK， 好，那个思云呢？你怎么建议？你会不会推荐任何的这个 painkiller 呢？他来找你，对不对？他有经痛，他这个痛，你会推荐他？
可能会先，因为他如果之前吃过很多种，就是都没有效的话，感觉好像其他止痛药的效果好像帮助不大。
好，那玉芬呢？
我也会推荐他 ibuprofen，然
ibuprofen
后可是我记得在台湾 piroxicam 不是非处方药，但我那天在药局有看到有这样子的成分的止痛药。但如果他用过 ibuprofen 就是我可能会先问他是用过哪一些品牌 ibuprofen，那我可能如果他真的很痛，我可能会推荐他软胶囊型的 ibuprofen，看他的那个释放上会不会吸收率比较高。然后如果还是没有用，会建议他去看医生，因为有可能就不是只是一般经痛的问题。
Okay. So, in the pharmacy, you can do whatever you can to help the patient. So, for patients, this like any pain, like period pain, try your best to help them as long as the medication is not contraindicate to her condition. But in this case, yeah, even she's try everything, but you can still recommend something like ibuprofen, or sometimes you can tell them ibuprofen, Panadol together, try it, see how it goes. But you have to remind the patient, if the pain still not help you, still not relief, see the doctor. Yeah, that's very important. You can recommend anything, but you have to tell them if not helping in 1 or 2 days, that could be something else, because anti-inflammatory, it should help for the pain, but if not helping a lot, it must be something other issue behind. So you have to advise them to see the doctor if nothing help. Okay, next one.
老师，我想问一下，ibu 跟 acetaminophen 是可以就是同时服用？
可以 yeah. You can have Panadol or ibuprofen together. It's not a problem. You can take this at the same time. But ibuprofen normally comes in 200 milligram. So the maximum dose is 6 tablets a day. And Panadol is 8 tablets a day. So when because in Australia, we have the combination like Panadol and Nurofen together. There's a tablet with a combination. So you can do that. Sometimes for people have severe pain, taking both might work better than just have single one.
然后那在使用上的时候，剂量要调整吗？还是就是照原本的那个频次跟就是原本单一成分的频次跟剂量？
I think just do the recommend dose. Just do it under recommended dose. 6 tablets for Nurofen, 8 tablets for the paracetamol. That's it. Yeah, you don't need to reduce the dose. But if you ask patient to maybe try half, is maybe that's the way to do it. Yeah, you can try that. You can try to tell them that. Yeah, take it together or separate. It's all fine. Okay, the next one is we call triple whammy. Triple whammy mean so as you can see here, celebrate. Do you know what is celebrates? The tablet, and also cover seal, and also LASIK. 这3种药你们有见过吗？应该有吧，在药局里面 celebrate 还有cover seal 还有 LASIK. Have you seen
好像没有，
哪一个？
中间那个 cover seal。
cover seal 它的那个 generic name called perindopril, perindopril 是一种ACE inhibitor. ACE inhibitor. Yeah. Corindophil 应该是有 Coversyl COVERSYL，你们 Google 一下 Coversyl。Yeah. 通常 I think in Taiwan or in worldwide they have the combination for like ACE inhibitor combined with antiuretic, right? 就是他们会将这个 ACE inhibitor 跟那个抗利尿剂一起来帮助这个就降这个血压。好，但是如果他们再加上这个 Celebrex 是一种COX-2 inhibitor, right? So when you have those three together, that can increase the chance of having a very causing renal failure, increase the risk. So if you see patient taking those three, it's very common, right? Yeah, patient on a high blood pressure drug and also have arthritis, so doctor prescribes Celebrex. Yeah, it's quite common. But when those three taken together, patient really have a very high risk of renal failure because those three medication they all been like gone through or through your kidney. Yeah. 所以这三个药，如果你们平常常常在你们在病人的那个他的吃的药里面，你都可以看得到，但是就是会引起这个肾脏衰竭的一个三种药的一种组合。所以你如果看到病人有这三种药，不是说他们不可以用 ，it doesn't mean they can't have those three, just because when those three they have those three medication together is in long term is no good for the renal function. Okay. So 这是台湾 so that's the product, OTC product for the cold and flus on Taiwan market. Yeah. Yeah, you can see there's a syrup or some sort of capsule. Yeah. Okay, let's come to the second case. Okay. So you have to ask the question as well. Okay. A regular customer, Mr. Wong, 60 years old, and want to buy some cough syrup. And his symptom is he's got headache. Okay. So you are the pharmacist. Okay. Hi, pharmacist. I have I'm having a cold. I'm having headache. I have runny nose and I'm coughing. So what question would you ask? 来，你们会问什么问题？
Since how long, what symptoms, are you taking any other medication
Okay,
for
just
treatment?
just one question. That's,
Yeah.
yeah. Otherwise, the other two will complain. Okay. So my symptoms been like 1 or 2 days. So I'm taking any other medication. I'll let you know later. Yeah, good.
Okay.
Okay. 思云呢？你会问什么问题？ What question would you ask?
平时有没有就是在吃高血压或是糖尿病之类的其他的
Okay.
药
So
物？
on any other medication? Okay. 玉芬呢？
有没有慢性疾病？就是平常
慢性疾病，对。
对，就是虽然他没有服药，但他有没有慢性病？
Okay. 所以我们刚刚想过那个 the first slide, yeah. You always have that slide, those question in mind. How long have you have symptom? Okay. Is it and also sometimes we probably forgot to ask the question, are you the patient? Are you the patient? You know, sometimes the husband came in for
Yes.
want to buy the medication for his wife or for his children. Yeah. So are you the patient? What's the symptom? Yeah. And any medical condition and take any other medication are you taking? Any chance to fall pregnant? Okay. Okay, so the question, yeah, similar. Taking any other medication, pregnancy or breastfeeding. So in this case, is Mr. Wong. So we don't have to worry about this. Any medical condition like asthma, glaucoma, prostate, constipation problem, kidney, artificial heart valve, yeah, and endocarditis, rheumatic fever, liver, heart or thyroid issue, high blood pressure, diabetes. Yeah. Okay. So he say he have like temperature for 3 days. Having and having temperature for 3 days or more. Yeah, because normally for more than 3 days is which mean they probably need to see the doctor. That's too long. Is it for children or old patient? Yeah, because for children and old patient, the cold and flu issue sometimes can be like more severe in those category. Or any chest pain or sore throat, or coughing, not going away, or any mucus? Any color mucus sometimes can be yellow or a little bit green, or smell any blood in the mucus or discharge. Any change they have to dry. Yeah, because some medication, cold and flu, after taking those medication can make people feel drowsy. Okay. Here the third question, asthma. For people having asthma, anti-inflammatory. Like Nurofen, doesn't matter which one, anti-inflammatory sometimes can aggravate the asthma. Okay. Okay, so this patient is taking perindopril, which is Carbasil, one tablet a day, yeah, for the blood pressure. Metformin, 500 milligram, one tablet twice a day, yeah, for the diabetes, and sitagliptin, Januvia for the diabetes, and sertraline for the so he's taking antidepressant, and atorvastatin, which means he's got some lipid issue, and aspirin, lower dose aspirin. So this patient, Mr. Wong, he's got diabetes, high blood pressure, and depression. 这是他的 medical condition. So what would you recommend any product to help his symptom? Remember his symptom? He's got headache. He's got runny nose. He's got coughing. Okay. So the first one, let's solve the he's got runny nose. So we have to find out sometimes some medication can cause like blocked nose or nasal stuffiness, like beta blocker, metoprolol, propranolol, or even alpha-1 blocker can cause some nasal issue like prazosin, tetrazosin, or sympathomimetic. So some nasal spray can help to reduce the blocked nose. Yeah, if that ingredient is for sympathomimetic. Yeah. After stop using it, people have rebounds nasal stuffiness. 所以说，如果有些病人他们之前会用一些这个鼻喷剂这个鼻喷剂如果你使用超过5天的话，就会如果超过5天以后，它会有反弹性的这个鼻塞。所以我们一般如果病人使用这一类的鼻喷剂，我们会建议使用不要超过5天，5天以后要休息。 So if patient is using anyone on symptomatic nasal spray, we have to tell them to use no more than 5 days. Yeah, after 5 days, they will lose effect. So if they want to keep using it, just tell them to have a break before they reuse the nasal spray. Okay, the second is any medication or can cause sore throat. Yeah, 什么药会造成病人有这个喉咙痛呢？第一个，例如说 cytotoxic 啊，cytotoxic 一般就是可能病人他们 people on a chemo drug or they have some immune disease, so they have some medication trying to cut down the immunity a little bit, yeah, and sometimes it can cause sore throat. Or people using the inhale, the puffer with steroid. Okay, so immunosuppressive therapy, methotrexate, yeah, those drugs. For those people coming to the pharmacy and complaining about any cold and flu symptom, you have to refer. Yeah, that's the warning sign. We have to refer to the doctor. 所以这个如果病人如果说他们来到药局跟你说他有这些感冒的症状但是在你询问之下，你知道他是可能有吃一些这个化疗的药，或者是免疫调节的药，或者是有一些吸入性的这个类固醇这些，因为这些东西有可能会就是表示说他的免疫力可能受到了影响所以才造成他有感冒的症状 ，like sore throat or any cold and flu symptom. Because they are taking those cytotoxic, chemo drug or immunosuppressive drug. So if those people coming to see you and have those symptoms, cold and flu symptom, yeah, is a warning sign. You refer them back to the doctor. Yeah, something wrong with their dosage. Yeah. Okay. So anything can cause cold and flu-like symptom. Yeah, cough. Yeah, knowing S inhibitor or angiotensin 2 receptor blocker can cause coughing, and beta blocker sometimes can make your heart slow down. So when your heartbeat slow down, sometimes you'll feel a bit like hard to breathe. So the symptom can be a little bit coughing because it's very hard for you to breathe. So you have to find out what is this cough from cold or flu, yeah, or it's from something else. Okay, so we have to make sure they don't have any severe liver issue or thyroid issue. Yeah, when people have thyroid issue, some medication over the counter can make their thyroid problem worse. Or okay, yeah, because like people having hyperthyroid, they symptomatic drug, we have to avoid. Yeah, or people having diabetes, so we have to increase the insulin dose. 所以说这个一般在感冒的时候这个糖尿病的病人，他们的血糖可能会一下子会飙到很高因为这个血糖增高可能是为了很多人生病的时候，这是身体的一种保护的机制所以说特别是血糖控制不好的人，他们就可能需要去在感冒的时候要去 monitor 他们的 blood sugar. So for people having like diabetes, when they have cold or flu, their blood sugar tend to go very high. So you always advise them, they might have to increase the insulin dose according to their, they have to check their blood sugar maybe every like 3 times a day, even 4 times a day. Yeah. And adjust the insulin dose accordingly. Yeah.
老师，那这样要怎么知道说，就是他到底要多吃多少？
那个病人他们如果他们有 insulin 的话，他们如果很高的时候，他们基本上 for those people on insulin, they normally know what to do. Yeah, yeah. 他们知道怎么做，他们可能会增加一点点剂量，然后因为他们都会测自己的血糖，所以说那个前提就是血糖要恢复到正常，他们可以加一些剂量，不然的话就是告诉他们说你再回去跟医生，如果他们不知道的话，请他们跟医生再就是去看一下医生。
谢谢老师。
Okay. And also, people having asthma, we try not to recommend any Nurofen dose NSAID, yeah, because the NSAID will make the asthma worse. And also for sedating antihistamine, have also other side effects like anticholinergic. So, 有一些嗜睡型的这个抗组织胺哈，他们会有这个所谓的抗胆碱的副作用。那这些副作用 for those anticholinergic effect for people having glaucoma or prostate problem, they can make it worse and also can cause constipation. 所以说if patient have prostate problem and you recommend the in Taiwan, those OTC, they comes in a combination. So for those drowsy, for those antihistamine can cause people drowsiness. That is what I'm saying, the one with anticholinergic effect. So if they have prostate problem, they can make the prostate issue even worse. Yeah. 他们可能会尿不出来。如果说他们平常就已经有这个前列腺的问题，然后你给他有这个鼻塞，然后你又给他吃这个嗜睡型的这种antihistamine 的话，他们的尿真的会尿不出来。或者是他们的有青光眼的话，这一类的药也会让那个眼压增高。Okay, so any other medical condition like they have high temperature for 3 days, yeah, that's a sign for them to see a doctor. Or if they have kidney disease or any endocarditis, 就是那个所谓的心肌炎，或者是以前有这个风湿热也他们有风湿热的话，他们可能以前可能那个心脏的瓣膜都有一点受损，所以说这些我们都要很小心，这个可能要让他去看一下医生。Okay. And we talk about aspirin should be avoided for the children or even for adult with influenza or chickenpox fever. Even though the aspirin is not used in the pharmacy now, but just be aware. Okay. And sedating antihistamine sometimes can cause the opposite. That can cause, we call paradoxical excitement. Yeah, antihistamine can cause drowsiness, right? And can cause sedation to some people. But for some kids, if you give them that sort of sedating antihistamine, sometimes can cause the opposite, can make the people feel very high. Yeah. Okay. So normally the cough syrup in Taiwan, that's the ingredient in some OTC product. Normally they have uh, acetaminophen, yeah, that can help for the fever, or they had methylephrine, which is what I'm saying, that is sympathetic，这是一种所谓的交感神经的拧交感神经的刺激剂，它可以帮助去黏膜充血所以如果病人有这个啊、有这个 thyroid 的问题，这个成分可能就会让他的这个 thyroid 就更严重当然it's not saying that you can't recommend those ingredients. But you have to advise, you have to tell the patient this medication can aggravate certain issue. Okay, it can happen. Yeah, just be aware. It's anything get worse, see the doctor. 然后有时候台湾的药里面也会有这个 cofeniramine，这个是一种嗜睡型的抗组织胺，或者是有咖啡因 ，OK，或者是guaco 就是它可能会有一些雀檀的这些成分，甚至还有一些有含当归、人参、刺五加这个 OK，and one of the category to use in the OTC for the cold and flu is nasal decongestion. Normally, it's called the medication category is under sympathetic 类交感神经刺激剂 like methylephrine, pseudoephedrine, or phenylephrine. Okay, but we have to be careful because those medication can increase your heart rate, causing your heart to contract, or increase your blood pressure, increase your eye pressure, increase your blood sugar level. Okay, and cause you have the issue for your bladder to let go the urine. Yeah, and can cause hyperthyroid. And antihistamine as the first generation normally can cause drowsiness, like cofeniramine, phenyramine, and dechlorphenyramine. So normally we use that for any allergy or rash, or even for motion sickness, travel sickness, the side effect drowsiness, and also here, very important, dry mouth, dry eyes, urine intention, because those dry eyes, dry mouth, urine intention, they are very typical anticholinergic side effect 这些抗胆碱的这个副作用就是一个字叫做干了，干嘴巴干，眼睛干，然后你的尿液会滞留，所以这三种你要提醒病人 ，you have to remind the patient after taking those medication, the next day you might feel your eyes a bit dry and mouth a little bit dry. If patient have a prostate issue, maybe it's not a good idea to recommend any product with this ingredient. Okay, so just like here, okay. Okay, anticholinergic, yeah, just like I say, dry eye, dry mouth, water retention, and also can relax the blood, the bowel muscle, so can cause constipation and blur your vision. Yeah, 所以他们吃了这些药以后，有干眼、嘴巴干、眼睛干，然后尿液滞留，然后眼睛的那个有时候会影响他们的眼睛可能会有一点模糊，视线模糊，然后因为它会放松你的这个肌肉，所以也会平滑肌的肌肉，所以也会造成constipation。 Okay, analgesic, yeah, normally aspirin is no longer option. Yeah, so you can see the pregnancy category is D. D is the like not recommended DDD. So we wouldn't use any we wouldn't use aspirin for any pregnancy woman. The only one safe is acetaminophen, which is Panadol. So in Australia is category A, and MU here mean may be used. And you can see three, maybe MU mean this is first trimester, second trimester, and third trimester. 所以在澳洲的这个怀孕用药等级呢，它有虽然说是 A，但是澳洲的现在全世界都已经开始去标示说，即使是安全的，但是它会告诉你在你怀孕有分为3个，第一期、第二期跟第三期，然后它会告诉你说第一期是不是适合，第二期是不是适合跟第三期，所以 Panadol 在这怀孕的三期里面都是可以使用的。那虽然 even though FDA now consider acetaminophen as a category B, but we don't worry about that. Panadol is still safe. Yeah. 所以 FDA 现在虽然把 Panadol 归类成 B 级，但是并不代表说它不能用，因为他们最近才改，最近这5年才改成这个样子，因为他们FDA 不太想要负什么责任还是什么。Okay. And the next one is ibuprofen. Yeah, in Australia, the category is C, mean yeah, it's not recommended. So you can see the first trimester is caution. Second trimester is caution, and third trimester is not recommended. 所以说在 ibuprofen、Nurofen 在怀孕，在澳洲来说，这个第一期是要小心，第二期是小心，第三期是绝对不建议 ，not recommend。Okay, and for the mucolytics 就是化痰的药，最安全的就是这个 Bisolven，yeah, bromhexine，这个 Bisolven is category A. So in Australia, say MU may be used, yeah. And in Taiwan, they use a lot for acetylcysteine. 这个在台湾，但是澳洲的话，这个怀孕用药等级是 B2，这个在澳洲是没有什么 commercial product 在台湾用的很多是用来化痰的。所以你们知道这个 acetylcysteine 是那个 Panadol 的 antidote 吗？ Do you know acetylcysteine is an antidote for Panadol? When you have Panadol intoxication, then in the hospital they just inject this drug. Yeah. 有听过哈？有学到哈 ？OK, good. 它平常是用作化痰的。有吗？你们在台湾的药局里面医生应该会开这个吧？这通常是一小包 in the sachet， 也
像小鸟饲料那个，常会被叫做是那个小鸟饲料，就鸟饲料，因为它的封面有一只鸟。
哦，是这样的 ，OK， 记得很清楚，非常好。啊，但是在澳洲的药局里面 ，only 这个 Bisolven can be used， 因为它是 Category A， 就是 for the pregnancy woman。OK， antihistamine， the drowsy one, the first generation is safe. So for anyone like who is pregnant, we can only recommend the drowsy antihistamine, like phenyramine or chlorpheniramine. The reason for that is because those drugs are the old drug. They've been on the market for a long time. So a lot of study or research it's been done. So that's why they put it under category A. It's not because And the non-drowsy one, the second generation is category B. So anyone coming to the pharmacy who is pregnant, we don't recommend like Carotone, Telfast, Zyrtec. We don't recommend those drugs because it's not category A. 有问题吗？可以吗？那个想睡觉虽然副作用比较大，但是它是怀孕用药等级是最安全的，因为它是一个老药，所以在市场上已经使用很久了啊，所以资料比较多，所以那并不是说这些第二代的不好，而是说他们目前没有太多的研究证实它是安全的，所以目前它还是归类在这个 B 级上。OK，antitoxic 就是止咳的，止咳的话，category A 的成分就是 dextromethorphan 或者是 codeine，yeah，they're category A. And nasal decongestant, you can see any nasal decongestant is either B2 or yeah, it's not category A, so it's not recommended for pregnancy women. Okay. And have you ever heard of serotonin syndrome? 有哈 Yeah. Yeah, this serotonin syndrome is very vital or very deadly. Normally can cause very high blood pressure or high temperature, and also sometimes can be twitching muscle or heavy sweating. Yeah. So when people taking and certain type of antidepressant and also on other drug, that can increase the chance of people to get serotonin syndrome. Yeah, you can have a look. Yeah, like antidepressant, like SSRI or a male inhibitor, or yeah, and also taking migraine tablet, and also taking like tramadol or dextromethorphan. See, so you can see here dextromethorphan. Even it's very common for antitoxic to stop the coughing. But if the patient is taking high dose antidepressant, we probably have to remind them for any sign or symptom for serotonin syndrome. If any sign indicate the serotonin syndrome, ask them to stop taking the medication. 所以这个 serotonin 的 syndrome 的最大的一般最常见的症状就是他们的血压突然升高，或者是这个体温突然升很高，或者是说有时候会那个肚子会好像肌肉会痉挛啊，或者是一下子流汗流很多汗啊，这些都可能就是 serotonin syndrome。那这个时候可能就要请他们要停药。而且最后这个是什么 ？Panic 精神就是人参。好，你知道台湾的很多这个感冒药里面，有的有人参了，所以这些都要考虑。虽然说，it might not happen. Sometimes it can be very rare, but if you find patient, or if you recommend anything with like dextromethorphan or any ingredient, that might cause serotonin syndrome, you better tell them. If you have those symptoms, stop taking the medication and see the doctor. Okay, so for that, Mr. Wong, what can we recommend? So for blocked runny nose, normally I'll recommend the nasal spray, and especially for normal saline nasal spray. Yeah, because this patient, 这个病人有什么 medical condition? High blood pressure, right? And also diabetes, and also some depression as well. So 如果if you recommend any nasal decongestant, so normally what's the ingredient for medicine for for those nasal decongestion is pseudoephedrine, right? You know, pseudoephedrine can increase the blood pressure, increase the heartbeat, increase your blood sugar, and no good for thyroid. So in this case, it's better you avoid any nasal decongestion. But how can you help for the runny nose? Yeah, you probably can recommend the nasal spray， 就是生理食盐水的这种鼻喷剂。好，那如果你真的你可以推荐他使用这个鼻喷剂了。我现在鼻喷剂，但是你要告诉他5天。这个虽然是一种这种 symptomatic 的这个 nasal spray， 你还是可以建议因为它只是作用在局部，它不是吃到全身，所以说相对上是比较安全的。那或者是你可以 you can recommend some antihistamine for the blocked nose. Okay, and for the sore throat, you can recommend some lozenge， 就是喉糖，或者是说这些漱口药水 betadine gargle, yeah, for the sore throat. And fever, headache, yeah, you can recommend acetaminophen, 就是 Panadol. 好，这是在这个 case 里面，如果你要推荐一些药的话，这会是比较安全的。OK， 那我们要避免 in this case, what can we avoid? What should we avoid? The first one is avoid the syrup, yeah, because these patients have diabetes. So for a lot of cold and flu syrup in Taiwan, yeah, the people use that a lot, right? Which is no good for the diabetes control, the blood sugar control. And we also have to advise them to monitor their blood pressure and also their blood sugar, and also discuss the serotonin syndrome. Yeah, because some medication might have that dextromethorphan, and this patient is also taking antidepressant like sertraline, Zoloft. Yeah, so they probably have the higher chance to get serotonin syndrome. Okay, valgodin, this ingredient probably not used in Taiwan, but before last year, this one is a very good cough suppressant. But last year, because of some safety issue, all the cough suppressant contain valgodin ingredient, they've been recalled. So like almost 80% of OTC product because of this drug, it's been recalled. So last year, before like February or something, we had if patient come in, they have any coughing, we really have no product to recommend. Okay, the reason they recall this ingredient because that increase the risk for anaphylactic reaction， 就是他们会产生这个休克，而且是因为它这个成分它在this ingredient will stay in your system very long, and so if you after using this medication and maybe in couple months later, even 1 year, after 1 year, if you have to go to the hospital to have a surgery, and normally this ingredient will interact with the muscle relaxant when you use in your general anesthetic， 在他们做麻醉的时候，他们会打一个那种肌肉松弛剂的。那这个肌肉松弛剂，即使在你吃了这个成分过后好几个月，甚至快1年以后，你还是有可能会发生这种休克这种症状所以 so that's why this ingredient, anything with valgodin, there's a worldwide recall last year. Okay, any question? Yeah, we finish our OTC product now. 有没有什么问题？ Okay, we still got 15 minutes.
老师，那就是这个成分是一般是出现在